A patient survives the surgery, wakes up, thinks the danger is over, but hours later her heart is racing, breathing becomes difficult, and her body temperature spikes. Within a short time, everything begins to shut down. This is the part of BBL that almost nobody talks about, because the Brazilian butt lift doesn't just carry risk during surgery. Some of its most dangerous complications happen after, and today we are breaking down step by step the complications that can turn a cosmetic procedure into a life-threatening emergency. Hi there, welcome to Mira's Health Hub, where we simplify health to empower you. Hit the subscribe button and let's begin this episode immediately. On today's episode, we're talking about BBL complications. Every surgery has its complication, don't get me wrong, but BBL's complications are unique because they involve multiple systems like the vascular, respiratory, and the immune systems all at once. And when these systems begin to fail simultaneously, the situation can escalate rapidly. Complications of BBL that actually happen inside the body includes: first, fat embolism. This is the most deadliest of the complications. The leading cause of death in BBL remains fat embolism syndrome. Now, this is not just a blockage problem, it's both mechanical and biochemical. Mechanically, fat droplets obstruct pulmonary vessels, reducing blood flow and oxygen exchange, while biochemically, those fat droplets break down into free fatty acids, which are toxic to the lining of the blood vessels. This triggers inflammation, capillary leakage, and widespread lung injury. So it's not just lung obstruction, acute lung damage has occurred as well. It presents like acute respiratory distress, severe hypoxia, and neurological symptoms like confusion or agitation. And the terrifying part is it can happen suddenly, even when everything seemed stable minutes before. The second complication is pulmonary embolism. This is the silent post-operative killer in BBL surgeries. Pulmonary embolism is different from fat embolism. Here we are dealing with blood clots and not fat. After surgery, patients are often less mobile, in pain, and dehydrated. This creates the perfect condition for clots to form, especially in the deep veins of the leg. It's a condition known as deep vein thrombosis. If parts of that clot breaks off, it travels through the bloodstream into the lungs, and just like fat embolism, it blocks blood flow. Symptoms include sudden chest pain, rapid breathing, shortness of breath, and collapse in severe cases. What makes pulmonary embolism dangerous is that it can occur days after surgery when patients believe they are recovering normally. The third complication is sepsis. This is a complication that transforms a localized infection into a full body crisis. After a BBL, infections can begin at liposuction entry points, fat injection sites, or areas of tissue trauma. If bacteria enters the bloodstream, the immune system responds aggressively, but instead of protecting the body, this response becomes dysregulated, leading to widespread inflammation, blood vessel dilation, reduced blood pressure, and impaired organ perfusion. In other words, the body begins to shut down its own organs. Early signs can be subtle fever, increased heart rate, and weakness, but progression can be rapid, leading to confusion, drop in blood pressure, and multi-organ failure. The last on this list is hemorrhage. In BBL, hemorrhage can occur during liposuction or fat injection. Large volumes of fats are removed, and in the process, blood vessels are disrupted. Sometimes bleeding is obvious, but in many cases it is internal and not immediately visible. As blood loss progresses, the body enters into a state of hypovolemia, leading to reduced oxygen delivery to tissues, increased heart rate, and falling blood pressure. If severe, this progresses to hypovolemic shock, and at that stage, vital organs such as the brain, the kidneys, and the heart begin to fail due to lack of perfusion. Here's what makes BBL complication particularly dangerous. They don't occur in isolation, they overlap each other. A patient who loses blood becomes weaker and less perfused. A weakened patient is more susceptible to infection, and an infected patient may become a septic one, and a septic patient is more likely to develop clotting abnormalities. Reduced immobility increases the risk of pulmonary embolism. creating a cascade effect and a chain reaction where one complication amplifies another. Early warning signs are critical because the early recognition can be the difference between survival and mortality. After a BBL, these symptoms should never be ignored. Difficulty breathing, sudden chest pain, persistent fever, unusual swelling or severe pain, excessive bleeding, excessive drainage, confusion or fainting. These are not normal recovery symptoms, they are all red flags. One of the biggest challenges is delayed presentation. Patients may assume symptoms are normal, underestimate severity, delay seeking care, and in some cases they may be recovering far from the surgical center or facility, especially those in the medical tourism setting. And by the time they present to a hospital, the condition may have already advanced. This procedure does not end in the operating room. Postoperative care is just as important, and they include early mobilization to prevent clots, proper wound care to prevent infections, hydration, and close monitoring for abnormal symptoms. A Brazilian butt lift is not just about how the body looks after the surgical process. It's more about how the body survives the process, because complications like fat embolism, pulmonary embolism, sepsis, and hemorrhage are not rare medical trivia. They are real, documented outcomes, and the most dangerous part is they don't always give you warning and they don't always give you time. And to the YOLO girlies, if you must get one, make sure you research your surgeon of choice, your facility of choice, read reviews very well, cause pre, intra, and post-op care is very vital for your survival and healing. If you enjoyed this video and learned something, give me a thumbs up and subscribe to my channel. Tap the bell sign so you are notified on when I post new videos on Tuesdays and Fridays, and I'll talk to you all soon. Bye.